Welcome friends. Today's video is on quality and patient safety in OPD. OPD is the outpatient department. So let us see that what first you mean by outpatient. What is mean by outpatient and what is inpatient? So in hospital we have two kinds of patient where the patient where the coming first time to the hospital to see to for the consultation and to sort the doctor about the disease and treatment, that is called as outpatient, where doctor will advise for the admit and further treatment and monitoring in the hospital stay. Then the patient will be admitted as an inpatient. So whoever will come directly to the OPD for the consultation, and where they're not required overnight care, and there will be patient will be discharged from the OPD only, there will be not required of the admission. That patient will be called as outpatient. Even daycare patient also is the outpatient only. That daycare patient also will be not considered as an inpatient, because they will come, they will get the treatment and they will discharge on the same day. So what's the requirement in OPD? If we are having one OPD, in OPD one registration counter will be there, one examination and treatment room will be there, and one consultation room will be there, and one patient waiting area will be there. Registration counter is what? Where the patient will come and do the registration, and they will get one unique UHID, hospital identity number, which number will be unique for one patient, where the patient if having two patient if having the same name, but their identification number will be different. So through the UHID, the patient will be identified in the hospital. And what is the examination and treatment room? In the treatment room, where the patient will be examined and treated, or eye injections will be given, dressings will be done. If small procedure, then that will be done. If plasters will be done in the treatment room. Consultation room is the where the consultant will sit and consultant will see the patient in the consultation room. Patient waiting area. Patient waiting area is the area where the patient will be waited for the consultation after registration. See, the first, in the registration counter, what and all quality and safety is required for the patient. So if you will see, first I have told already that patient identification. Patient identification is the most important in the hospital. If we are not identifying proper patient, then the patient will be get treated incorrectly. So patient identification is the most important thing. For what? For which patient have to give the demographic data correctly to the reception counter, where the patient will be registered. If the patient will provide the name, age, sex and their contact number and the address correctly, that patient will be registered in the HIS, hospital information system. The patient will be registered there, and after that the one UHID will be generated. Unique hospital patient identification number will be generated, and that number will be allotted for that patient. Whenever the patient will visit to the hospital, that UHID if will tell the patient, then patient details will be taken out from the HIS. Patient demographic data also should be entered correctly. For that, what and all required? For the patient demographic data correctly entered, for that one self registration form will be given to the patient, where patient will do the registration, enter the data in that. After that entry of the data, they will hand over to the registration counter. Then registration counter person will verify the data by read back policy with the patient, and they will do the registration. Once the registration will be done, they will generate the UHID. But to avoid the confusions, we can go for the kiosk self registration. So self registration will be done by the patient, where The patient demographic data, incorrect data can be avoided. So the data will be entered by the patient in the self registration. The data will be correct and patient will get the UHID spot. The next is the side rails. Side rails is what? Side rails is that where the registration counter patients are standing in the queue. Rails should be there to prevent the patient to fall. So patient fall prevention, we need the side rails where the safety is concerned. Read back policy. What is read back policy? Read back is that to verify the patient demographic data with the patient for correct identification. Then self-registration, already I told. Then patient prioritization. Patient prioritization is the most important as per NABH and JCI also, because if we are not prioritizing the patient, then patient may get delay the treatment. If wherever the requirement of the patient should go and so to the doctor on the priority. If patient is having the dizziness, vomiting, low BP or high BP, or patient is having the chest pain, there the prioritization is required, where the registration counter will do the patient prioritization and they will send, if required, patient will be sent to the emergency department for immediate care. Then display of available services, what and all services we are providing, that is most important in the registration counter to be displayed, because as per that patient will explain the issues to the registration counter and which consultant they need to consult, that will be identified easily. Display of waiting time for the consultation. Waiting time is the most important things for the consultation, because patient will not have that much patience to wait to get the consultation done. So if we will be communicated to the patient about the waiting time and the time required for the consultation and how many patients are waiting before them, then it will be easy for the patient to have a patience and patient will not get frustrated. And appointment system, if appointment system will be there, then we can reduce the waiting time. And waiting time should be monitored for each and every patient in the registration counter. When the patient is coming to the registration till to the patient consultation will be considered as a patient waiting time. Once patient done the registration till the consultation, enter to the consultation room, the waiting time needs to be calculated. And this is one of the parameter and quality indicator for the NABH for the waiting time consultation. Quality and patient safety in the examination room. So in the examination room and treatment room, what and all required, the facilities. Facility wise, if we'll see, the examination couch should have the side rails, because the patient, whoever is coming for the treatment or examination, they should not fall down and they should not get one more injury where they have not come for that. Whatever they have come, they should get treated well and they should go to home proper. So side rails is the most important in the hospital for every corners. Like if you will see in the walking area pathways, the side rails is required for the patient to hold and walk. Side rails is required in the beds. Side rails are required in the examination couch. Even we required the grabbers in the toilets. So side rail is the most important thing in the hospital to prevent the fall. Next is hand washing facility. Hand washing facility should be there to prevent the cross infection. One patient we are treating and we are going to treat the another patient, means there should be hand wash done. And before touching the patient, after touching the patient, hand washing is the most important thing. As per the WHO global hand wash policy, we should follow the steps of the hand wash and hand hygiene. So, and the hand wash facility should have the proper hand wash where the opening date and expiry date should mentioned in the hand wash. What is the opening and expiry date? Why it is required? Because once the hand wash has been opened, that is valid only for 28 days. So any chemical in the hospital should be used within 28 days. This is the policy. So hand washing opening date should be mentioned, expiry date should be mentioned, hand wash poster should be there, so it will be easy the person to follow the hand washing steps and to clean their hand properly to prevent the cross infections. Competitive and experienced staff is required who is having the knowledge of proper treatment and doing the plasters, giving IV injections, helping the doctors for the small procedures to done. So the competitive staffs are required. How we will know the staff is competitive? The regular audit needs to be done for the staff. Then wherever the staff is getting, new staff is joining, then the staff personal file should be verified by the quality department. Wherever the internal audit is happening, that time staff file needs to be audited. Staff should be asked for their knowledge. Staff should be asked about their regular experience with the patients. We should collect the patient feedback also about the staff. Then we can improve the staff competency in the field of treatment. Then biomedical waste discarding. Biomedical waste is what? Biomedical waste is the waste generated during the treatment of the patient, whereas that is infected. Biomedical waste and general waste both are different. So we'll do the one more video on general waste, biomedical waste and all, but for the timing I'll tell just simply general waste is the waste that is non-infected waste. Biomedical waste is the infected waste where the waste is being generated from the patient side. So to discarding the waste properly, before that we have to do the proper segregation. So segregation should be done at the time a point of generation. So wherever the waste is being generated, there only the segregation should happen. So once the waste is segregated, the waste should be discarded properly. So for that, biomedical waste posters should be displayed where the biomedical waste dustbins are placed. One separate area should be allocated for the biomedical waste dustbins to place, and the poster needs to be displayed upon that where the biomedical waste to be discarded into the proper bins. Why it is important? Because to prevent the infection and for the patient safety. If we'll not do the proper segregation, then we can get the needle stick injury whichever is used for the patient, and needle stick injury is very very harmful for the staff. If the patient's used needle is get punctured in the staff, and then we don't know the patient is positive or negative. Positive means what? Positive for the immunocompromised patient, then your HBsG patient. So we don't know what kind of patient is. So we should avoid that kind of getting infection from the patient. So the waste to be discarded properly at the time of segregation to generation to the segregation to the discarding, it's to be done properly. Then patient privacy is the most important thing and one of the most important parameter of NABH. So patient privacy needs to be followed. If the patient is treated by a male consultant, one female staff should be accommodated with those consultant. Then screen should be there for the patient to cover each side. Blanket should be provided to the patient. So patient privacy is the most important thing in the examination room. Next is equipment and medications. Whatever all equipments are required in the treatment room. So treatment room, one most important thing is the crash cut trolley. Why the crash trolley is required? Crash trolley is the important trolley which is having the important drugs, emergency drugs, life saving drugs, and the defibrillator. So crash trolley, we don't know where the patient will crash, at what time the patient will crash. So crash trolley is important to have each and every corner of the hospital, where the if the patient is getting crash in any of the area, the crash trolley should immediately reach. So in treatment room, various patient is getting treated, so crash trolley is required. So crash trolleys should be under lock and key. Lock and key is not mean the of the cart should be locked. No, crash should be locked like tagging. How we are getting in the malls, right? Malls, we have the tags, but for the crash trolley we have the numbering tags. If one number we are cutting, then that number should be mentioned in the crash trolley register that this number has been carted. Why? The region also should be mentioned in that. And the audit of the cart should be done every weekly basis, and monthly basis. And LASA arrangement should be done. What is LASA? LASA is look-alike and sound-alike drugs. So look-alike and sound-alike drugs should be arranged as per the policy. High-risk drugs should be arranged as per the policy. Stickering should be done properly, and crash trolley should be maintained in the treatment room. Defibrillator should be checked daily, and the validation should be done, because sometimes the defibrillator timing and our time will not match. So whenever the patient will crash and we have used the defib and we have taken the reading timing will not match with the actual time. So the defibrillator should be checked properly for the timings, for the working, and the defib should be on charge every time. Oxygen should be there in the treatment room, and daily checking, validating should be done for the oxygen meter. Emergency medication should be there in the treatment room, that should be audited by the staff daily. Record should be maintained for that. All equipments calibration needs to be done. Preventive maintenance needs to be done. Yearly calibration is yearly, and preventive maintenance would be 6 months. It depends upon the instrument how it should go for it. Then one treatment trolley is required, where the opening and expiry date of the chemical should be there on all the bottles. CSSD items should be checked daily basis, like dressing trays and all. We have to see that it has been passed or not. The process indicators, wherever they are using, the chemical indicator has been passed or not. So these are the things where we have to think that okay, these are the requirement of patient safety. If the process indicator and the your chemical indicator and all, if it is not passed, then that tray should not be used for the patient. That should be returned to CSSD immediately. So these are the concern we should see in the treatment room. It is not simply like okay, treatment room OPD basis, what quality is required, we can do it easily. Like no, each and everything's matter for the patient safety. Quality is nothing. Quality is safety of patient. Quality is nothing like we are seeing okay, this that branding we required. Yes, if you have the safety of the patient, you can do your branding. So these are the things where we need to check. Then in the treatment room, if whenever you are doing any invasive procedures, there you have to take the consent. So any debridement you are doing, any invasive procedure, whether your blood is involved, like you are cutting any skin or anything, then you have to have your procedure consent. Like for the dental OPD, if you will see, when you are removing the teeth, there you needs to take the consent for procedures. So any small procedures you do, but the thing is that procedure consent needs to be taken. What is the procedure consent? What and all is required in the procedure consent? Let us see. So this is the procedure consent, where you have to write the name of the patient and the whatever the patient language that should be mentioned, and all the procedure risk and everything should be explained to the patient in the language patient understand. And the consent should have the benefit, alternative, and the potential risk involved, that can be printed, that can be left like this blanks, and it can be used by the consultant to write what and all benefit, what and all risk, what and all complications, and what is the alternative for this. Every procedure should have the alternative, risk, benefit, and complications. Then patient should be explained about the risk, benefit, complications, and alternatives in the language patient understand. If the patient is minor, then it can be explained to the patient parents, and the signature can be taken accordingly. Witness signature also equally important, and the interpreter, if any required, if any high risk procedures and all, then interpreter also required. And most important, doctor signature. Whoever the doctor is doing the procedure, they should sign it. This is the most important thing, where doctors used to think like small procedures not required anything. No, any procedure, if you are touching the patient, then you should take the consent on the procedure consent. Patient should sign the consent, doctor should sign the consent, then you can do the procedure. Then safety checklist. Safety checklist is what? Safety checklist, WHO safe surgery checklist. WHO safe surgery checklist, that is the required in the surgery, right? But yes, wherever we have the procedures like any invasive procedures, then safe surgery checklist should be followed. In OPD also, we can create a very minimal requirement, what and all the requirement, time in, sign out, time out. That minimum requirement we can put, and we can create a checklist. For the dental, we have a dental separate WHO dental safe surgery checklist that can be used for the patient. And for the radiology procedures also, we have the radiology one safe surgery checklist, so that checklist can be used. But yes, for any invasive procedure, you should have a one safe surgery checklist, safety checklist. Then quality and patient safety in the consultation room. In consultation room, what is required? Patient is going, doctor will see, and patient will come out. But yes, that also we need the safety of the patient, where sample medication should not be used, and sample medication should not be kept in the consultant room. If they are keeping, then there should be one owner for the sample medication, that should be accountability should be there for the sample medications. And hand washing facility, should be there in the consultant room, because patient to patient, when they are treating, they should do the hand wash, they should not do the cross contamination of the infections. Then patient privacy, yes, it is most important thing is the patient privacy in the consultant room. Digitalized prescription. Why digitalized prescription or standardized prescription is required? Because there should be no confusion for the drugs to take, doses to take, and the drugs should be written in the capital letter. So capital letter to write, if it will be digitalized, it is more helpful for the doctors and the patients to understand. If a hospital is not going for the digital prescription, then they can write the capital letter. That is the, according to law, medical ethics and medical law, they have to write the drugs in the capital letter only. and the minimum requirement of the prescription, like name, age, vitals, and the nutrition requirement, and the drugs, medications, investigations, and the follow-up. Most common follow-up. Follow-up is a important element in NABH chapter, objective element. So follow-up should be written for each and every patient. So the standardized prescription should be taken care by the hospital. Then weighing scale calibration is required. Biomedical waste segregation also is important in the consultation room. Waiting area. What is the importance in the waiting area? Waiting chairs is required to patient seat. Waiting chair should have the side handles because patients should not fall down. TV or some education material should be there. If you are putting the TV, don't put any other ads or like normal TV shows and all. Like, just put the education material where patient will get educated about their health. Education material means what? Education material for patient safety, like how to take the medications, how to take their during travel, what the patient should carry with them, and some important things which will be helpful for the patient. I will share the education materials also in the upcoming videos of mine. So these are the some education material which will help the patient for their daily living lives in the home also, what and all they should do, why the grabber is required in the toilet for the elderly patients or for the general patient wherever the patient is not feeling good. So these are the things should be continuously rolling in the TV, and patients should get educated on that, because general public will not get the health education in the public areas. They will get the health education in the hospital. So we should take that advantage and we should educate the patient on that. We should provide some brochure on the patient safety and health educations, and water facility and cafeteria, which is most important to uh, take to satisfy one patient when the patient is in the waiting area. Okay, what other things is required for the patient safety in the OPD? For patient safety, we need to have the anti-skid floor to avoid the fall while walking of the patients, and we should have the washroom for the different for the male, female, and disabled friendly. And in the washroom, most common things is required, that is grabbers. Each toilet should have the grabbers where patient can hold, and patient call bell system. Patient call bell system is equally important. If the patient is went inside and anything has happened, they can press the call and anyone can attend immediately to them. So this is very important, taking care of the washroom for the patient safety. And last but not the least, that is patient feedback. Patient feedback is the most important thing in the OPD to take from the patient, because in IP during the discharge you can take the patient feedback. OPD, once consultation done, patient will be in hurry to go to home, but yes, you can provide a link to the patient, you can show a QR code, you can take the digital nowadays every hospital is going for the digital feedback, because the paper feedback is the old term now. But yes, if the hospital is still having the paper feedback, I'll suggest to go for the digital feedback, where your money will save, your time will save, your manpower will save. If you will calculate your manpower, your feedback forms, your patient times, and your patient feedback, then you will definitely go for the digital feedback. Nowadays lot of company are providing digital feedback with the very minimal expenditures, like minimal rate, so you can go for that. And yes, I know some of the companies, I can provide the contact also if anyone required. You can comment on the link in the video, so I will provide you the contact of the digital feedback companies numbers and their contact, so they will provide you in the best rates also. Then next is the patient reported experience measures. Now in the NABH, PREM and PROM, this two is most important for any services, not only for the OPD, IPD or radiology or anything. Everywhere the patient experience and patient outcome is important. What is patient experience? That will do the separate video, PREM and PRO. But for simple understanding, I'll tell that patient experience about their services during their visit to the hospital, like what their experience with the consultant, their experience with the nursing staff, their experience with the treatment, their experience while doing the plastering. Whoever is coming to the orthopedic OPD during plaster, what is their experience? How was the consultant behavior? How was the technician behaviors? That and all we have to take a survey. So that is called patient reported experience measures. Patient reported outcome measure. Outcome measure is the thing that patient already taken the treatment, how the patient is doing. That should be taken as a feedback. That will be called to the patient after discharge or after going home after 2 or 3 days, how the patient is doing and all. That is called as PROM. So any surgery patients, they have discharged, they have went to home, and we can call and take the for the SSI PROMs we can do. Like diabetic patients, whoever the follow-up diabetic patients and all, for them we can do the follow-ups. Hypertension patient, how their treatments, how they are responding to the treatment and all, that PROMs can be done. Okay, so these are the things which needs to be taken care in the OPD. If anything more you need to understand from me, then you can comment on in this video. And anything if you want to tell me and I left also, that also you can comment, then I also will get learn anything from you also. Okay, thank you so much friends. Please, if you like the video, then like and subscribe my channel and comment. Your comments will motivate me to do more videos, so please comment how was the video. Thank you so much.